So our solution, so SmileTrain was started with the belief that medical missions or camps, surgical camps, do not solve the problem of children born with a cleft. So we partner with local hospitals and doctors. We empower them through funding, through training, through safety infrastructure, so that children have access to a 24/7 setup where they can receive full comprehensive cleft care. So not just surgery. Next, please. So it's not just surgery. Surgery is obviously the first step to treatment for the child. But children need other help. Their parents need to understand why a cleft birth happened in their family. Children, they need help with feeding of that child because these children are prone to malnourishment. And I think our next panel talks about nutrition. So you can understand how important it is for a child. A baby who is not able to gain weight cannot get a surgery, which they need so desperately. So SmileTrain is actually going through the whole 360-degree approach to cleft care. So surgery being obviously the fundamental block, but we also support other things like speech therapy, orthodontics, and other care. We also host India's only national cleft helpline. This is a number which is like a lifeline for parents with newborn babies with clefts or patients looking for help. They are able to call in. We have our own in-house team which answers these calls. It's not a call center. And we are able to guide patients and families get the cleft care they need. Next, please. Next, please. So how are we really doing good for Bharat? I would say it's huge. India, we have supported more than 7.5 lakh surgeries in India alone in the last 24 years. And it's beyond just providing partnerships with hospitals. We have some strategic partnerships which focus on various aspects of cleft care. We have a partnership with the NABH, and this partnership focuses on improving the quality and safety of care that we provide at all our partner hospitals. We also have a partnership with the Federation of Gynecologists and Obstetricians, wherein they are the first people to know that a child has been diagnosed, or rather a fetus has been diagnosed with a cleft lip and palate. So we have developed a protocol with Foxy, wherein gynecologists are able to not only diagnose that a child, his baby has a cleft or a fetus has a cleft, and they are also able to advise the parents on the timelines of cleft care, even before a birth of a child. So these are just some of our initiatives. We also partner with National Health Mission under their Rashtriya Bal Swasthya Karyakram. And the aim really here is that ASHA workers are able to identify newborn babies with clefts, and they also are able to refer them to our partner hospitals for treatment. Next, please. So going beyond treatment, we also foster the cleft community. So in India, there are over 20 lakh people who live with clefts. So even if you had the surgery, you still face problems with speech. It's a long-term care, so up to the age of 18, children may need help. And they also need help with their mental wellness. So we have created a platform called CleftCon, wherein we foster the community, we give them a platform to come together, we celebrate success stories, and just give them that support system that they need. Next, please. So we recently, because we completed 25 years this year, so we did a global study of the economic impact of receiving primary cleft surgery. So that is the first surgery that a child needs. And how getting the surgery on time can reduce your disability-affected life years. And we had hired an agency which was able to actually translate that into the economic impact that it creates. So SmileTrain in the last 25 years has created an impact of $69 billion across the globe. And out of that, just 12 billion is the impact that we've created in India alone by simply providing surgery to children in their early years. Next, please. None of this is possible without our partners. I think this is true for all NGOs, and people from NGOs out here know this, that we cannot survive or we cannot function without the generosity of the people who donate to us. And this is a CSR and ESG summit, so I just want to acknowledge some of our corporate partners. These are the people who are, backing us to provide this life-changing treatment to children. Next, please. I also want to share a very, very broad overview of an impact, quality of life and impact study that we commissioned with KPMG India, and the key findings were shared this year. So just very briefly, the findings, first is alignment with national priorities. So the cleft program of SmileTrain aligns with the SDG goals and the National Health Mission's priorities for the country. Next, please. I think some of the very interesting facts that we found out, especially how we made an impact in the lives of not just the children that we treated, but their families. The first was financial burden. So most parents said that they could not have afforded treatment for their child without getting support from an organization like SmileTrain. So that is a significant finding. And the other one is that the knowledge and the counseling that they received at our treatment centers, that was really helpful for parents to understand why their child was born like this, and also for the child, their friends, their neighbors, their relatives to accept that child. So these are significant, I would say, impacts that we have had. And also children after treatment were able to, they had improved facial function, they could eat properly, speak properly, they were accepted by their peers more easily, they were felt more confident. Next, please. We still have patients who face speech problems and other issues, which only shows that we still need to expand our comprehensive care even further. So go beyond surgery and make sure that children have access to other care that they need, like speech, like dental, like orthodontics. Next, please. That is one aspect. And the other impact that we found was that the investment that we made with our treatment partners was they could reach out, or rather treat many, many more patients because SmileTrain was able to support them. SmileTrain through donors like our CSR partners. And also the knowledge and capacity building, 82% of our partners said that they had up to 20 to 25 days of training via SmileTrain, which helped them build their capacity as medical professionals. Next, please. We also calculated something called social return on investment, which is really the social value, not the economic value, the social value of this program, and which was a very, very healthy, for every 1 rupee invested, there was a social return on investment of 5.1 rupees. So with that, I just want to thank everyone, and I think the theme this year is doing good in a better way, and let's work together so that children receive the care they need in a better way. Thank you.